Okay, so Pooja has asked a very good question that how do you withdraw samples from the central line, especially if you want to collect blood cultures or if the vasopressor anatropes are going through it. So understand that there are not many comparative studies on which procedure or which method is good over the other, but there are certain recommendations which are followed worldwide. So one is your waste and discard method, the other is flush, then waste and discard method, and the other is push and pull method. So push and pull method will not review because very few practices are there. So only thing waste and discard method and flush then waste and discard method. So suppose there is a central line in place, no infusion is going through it, only central line is in place. So waste and discard method means obviously you will clean the house with 70% alcohol, all those sterile procedure you will take care. Now in waste and discard method, you will simply withdraw some amount of fluid like 5 or 6 ml, discard it, and then you collect the sample in which you need to take the lab reports, and then you would send it to lab and again flush it with the 10 ml saline and close it. So this is waste and discard method. Flush and waste and discard method means you will flush with 10 ml syringe saline, then withdraw 6 ml and then discard it, and then you will take the sample and send to the lab. So it was observed that in flush then waste and discard method, the results are more accurate even if you do for coagulation studies like PT and APTT comparative to simply waste and discard. If you flush it with 10 ml saline initially and then take the sample, discard, and then use the next syringe sample, it is more accurate. Now, if infusions are going through the central line, suppose TPN is going through it. So for TPN, you need to flush it with 20 ml saline, 10 ml so two syringe. Now, suppose there are infusions going through the central line. So if the infusions are non-critical ones, which you can stop it, like midazolam, fentanyl, or propofol, like things. All these infusions needs to be stopped for 1 minute, and then you need to use the flush and then waste and discard method. Now, suppose certain infusions you are critical ones, you cannot stop it, you cannot flush it, like vasopressors. So for this, you need to use other site like peripheral site. But even if you don't have a peripheral site asset, then make sure the vasopressors are going through the proximal port and you collect the sample from the distal port. In that, don't use the flush method, simply discard and discard method should be used. Now, if you want to collect blood cultures, then neither the line should be flushed nor the sample should be discarded. You simply withdraw the amount of blood, collect in the culture bottle, and then send it. We don't want to flush and discard the for blood culture because in blood culture we want that the blood which is available in the central line needs to be tested, and because we are not doing in the biochemistry, we don't need to discard any blood. So I hope this was helpful. Do read more about it.